Hi. This series on prognosis is becoming popular and we would like to add one more disease and try to understand the scope of homeopathy for its treatment. This time we'll talk about eczema and atopic dermatitis. Both are more or less the same skin conditions which affects the skin, leading to inflammation on the skin, inflamed patchy skin with lot of itching, redness, swelling, sometimes oozing. World's estimated 2.5% population suffers with eczema, especially in early years of life. My name is Dr. Rajesh Shah. I am a director of Life Force Homeopathy, and we treat patients of chronic diseases from across the world. We have been treating patients for over 3.5 decades. One of them is eczema. This presentation on the prognosis of eczema is based on the treatment that we have documented at Life Force of about 2,200 patients, which include children as well as adults. Eczema is essentially an immunological condition. As I always say, it is a disease on the skin. It is not a disease of the skin. It is a disease of the immune system, and it has to be treated by correcting the internal immune mechanism and not by treating it from outside by applying immunosuppressant or anti-inflammatory medicines such as corticosteroids or such similar medicines. The scope of homeopathy for eczema is excellent, I would say. Most of the cases they respond extremely well to homeopathy. It is not that within a very short time we'll get rid of eczema or atopic dermatitis. It is challenging. It takes little time, but overall the results are very good, very encouraging and very positive. The cases of atopic dermatitis or eczema in children, sometimes infant 1-year-old babies become with eczema affecting the cheeks and many other body parts like hands and arms and vital foci and behind the knees, etc. And they come with severe intense itching. This allergy could be because of external factors such as milk or dairy or proteins or gluten or exposure to some other chemicals or other substances, or sometimes it could be because of internal causes, immunological causes, and as a result there may be severe intense itching and redness of the skin. The cases which are not treated heavily with the use of immunosuppressant medicines such as corticosteroids are relatively easier to treat with homeopathy. The cases which have been treated with oral steroids or topical steroids, topical corticosteroids for a long time, they are relatively more difficult to treat, because once we try to reduce the use of topical corticosteroids, then there is likely to be a flare-up, an increase, not because of starting of homeopathic medicine, but because of stopping or withdrawal of the steroids. And that phase has to be managed properly with patience, with moisturizer, and with some other additional homeopathic medicines. If this phase is taken care of, then there are good chances that one may get rid of dependency on corticosteroids. In the cases of eczema and atopic dermatitis, many times when we treat these cases, our challenge is dual, in the sense that we have to treat eczema at the first place, as well as we have to also treat the dependency on corticosteroids or immunosuppressant medicines, because most patients are consuming those medicines and the body gets kind of addicted, as I use the word, to these medicines, and the withdrawal could be really challenging. That's why we always say you will have to keep patience while we are treating the cases of eczema or atopic dermatitis. Some patients who come with eczema of many years duration, maybe 20 years, maybe 30 years, especially on the legs. It may also lead to additional deeper tissue inflammation like cellulitis. Some patients may develop certain ulcers. That category becomes more difficult to treat. If the patient is also having associated diabetes mellitus in the background, then again it poses additional difficulty in the treatment of these eczematous patches. So the duration of this treatment depends again on various factors, as I mentioned now. But all in all, one may have to take the medicine maybe for 2 years or even longer. Some cases could be very difficult when we come across adolescents, 12, 15, 17 years old, kids having atopic dermatitis, sometimes even adults in the mid-20s or even early 30s. And they might be having atopic dermatitis affecting the entire body, skin all over the body. And for many years from childhood, we have seen number of cases where even adults, they have this chronic long-standing eczema all over the body, and they usually come with having consumed corticosteroids in various forms. This is a very difficult variety, and they take longer. We have seen some success in these cases as well, not in all the cases though. And homeopathy is of course very strongly recommended, I would say, in all the cases and all the stages of eczema. I always say earlier the better. So when you go for homeopathic treatment, you must go with this understanding that homeopathic treatment is not a superficial way of just eliminating or treating your skin lesions or itching from outside. Homeopathic medicines is essentially addressing your internal cause the immunological reasons behind eczema or atopic dermatitis, and that has to be treated. And to be very honest, we do not understand it fully about what exactly predisposes one to develop eczema or atopic dermatitis. It's a complex immunological war inside, and which is not fully understood. And with this limited understanding, we have to treat this disease internally, which is not very easy. It gives us a challenging time. It requires in-depth understanding of the subject and of homeopathy as well. And with that understanding, we can approach this disease. I hope this video helps the patients suffering with eczema, the parents whose children might have eczema, as well as the students of medicine and the medical fraternity. Thank you very much.